Hey everybody, welcome back again. And I'm really excited that you chose to click on the next link because now we want to talk to you about back pain. And what we're really talking about is lower spine pain, or it affects your low back, right? And if you've clicked on any of the other links, folks, you're going to see a ton of similarities, but how we implement things are going to be just a little different, okay? So your neck, what we looked at prior is looking at your neck and the upper extremity. Now we're going to do back. So what's it going to be? Your low back and your lower extremity. So if we have low back pain, we also need to check out and see if do you have a pelvis issue, which involves your hips. And if you've got a pelvis issue and a low back issue, it's going to give you knee issues as well. So we want to, in our consultation, we want to do a thorough evaluation as to where your different issues are. Because if you have one issue and you've had it longer than 10 years, then it's wearing on different joints and we need to figure that out. Does that make sense? So we're going to go through a thorough consultation to figure out when did it start, where did it start, was it a trauma, was it a repetitive injury? Let's figure out what started the ball rolling. It could be that you were standing on concrete for 20 years. It could be that you had an old sports injury, or it could be that you had a car wreck. Whatever it is, your body is your history book. Remember that, folks. Your body is your history book of your life from conception forward. So we need to see exactly what's going on. We're going to do a thorough consultation to find out everything on your body on what's going on. Then we're going to move on to a functional exam. And that's where we're going to put your body through different motions to determine which tissues are involved and which joints are involved. And again, before we move to 2 and then on to 3, each step has to give us the information that warrants the next step. So after your consultation, if we have enough information that warrants an exam, then we're going to do a full functional exam. And if the exam provides us with enough documentation, then we're going to move on to functional diagnostics. So again, like your heart, I used this example in the last film with your heart. If I'm going to do a heart functional exam, it's called a stress test. We're going to put you on a treadmill. We're going to get you walking on an incline, and we're going to stress the heart and see how it responds to the stress. We've taken that same approach with x-rays. So if you're having back pain, we're going to have you standing because I'm stressing the low back, and then I'm going to take an x-ray. And then if need be, I may have you bend to one side or the other side, and that tells me how your spine is functioning, how your low back is functioning when you move. Critical pieces of information that we need to know. If we also need to do an ultrasound, it's the same way. We're going to stress the tissues and then see how they respond to the stress, and then capture that on an ultrasound. That makes perfect sense, doesn't it, folks? This is where we do things different. Number 4 is the team approach. And in our team approach, we have medical doctors, nurse practitioners, chiropractors, and rehab techs. We all sit down and we review your entire case collectively, folks. We review your consultation, we review your exam findings, we review your diagnostics, and each provider is going to have input on what we can do to get you better faster, cheaper, and keeping your own joints. And that is very, very important. Keep your own joints. And we're going to come up with a functional treatment plan. Now that treatment plan may include regenerative medicine. It may include that. It may include medical care, which is trigger points, joint injections, different types of things there. You may need that to get you from point A to point B. It may include back bracing or knee bracing. Makes sense, right? It's definitely going to include rehab, because there's certain muscles that need to be stretched and there's certain muscles that need to be strengthened to restore normal functional stability within your core and your low back. And we're going to get you there. And we also have chiropractors, which are going to restore the normal biomechanics of the spine and the pelvis, so that when you do your rehab and when you do your regenerative medicine, things are fixed in a normal position and not an abnormal position. Does that make sense, folks? That's why we're different. And that's why I'm so excited that you clicked on our link about back pain. Because we do functional tests, we do a team approach, and then we do a functional treatment plan incorporating many different treatment styles into one unit, which gets you better faster, it gets you better on a lower cost, and it keeps your own joints. Critical pieces. So I want to make you an offer. If you click below, we're going to offer an introductory exam, which is an exam and consultation at a reduced fee. Please take advantage of it. Let us figure out if we, one, can help you, two, how we can help you, and three, let us incorporate the team approach to get you better, faster, and allow you to resume the lifestyle that you want. And that's what we do here at Advocate Integrative Medicine. We give you your lifestyle back with your own joints. Please take advantage and click below, and I'll see you shortly.